Hello, my name is Dr. Chad Price, and I'm a pediatric orthopedic surgeon at the Arnold Palmer Hospital in Orlando, Florida. What I want to talk about is hip dysplasia. Now, hip dysplasia is the most common abnormality in newborn infants. But surprisingly, most people think of hip dysplasia in dogs. They're not really aware that it happens in people. But it's very common in people. It occurs in about 1 out of 20 children, and thousands of adults have silent hip dysplasia that leads to arthritis when they're older. So why don't we know more about it? Why haven't we heard about this? Well, it is silent, and the cause is not known. The cause is obscure, but we know that human babies are not born ready to walk. Their hips are poorly formed, and there are hormones that the mother makes around the time of birth that allow the ligaments to become loose. So hip dysplasia is a variety of things. It means looseness of the hip. The hip can be a little bit loose and unstable, or it can be completely dislocated. That can be hard to detect. Routine pediatric care by your pediatrician is the best way to detect it. And examinations are very helpful. After the age of 6 weeks, sometimes an ultrasound is obtained, and that can help detect hip dysplasia. After 6 months of age, an X-ray can detect it. But early treatment's really the key. Early treatment in an infant simply consists of a brace or harness or something that keeps the legs spread apart and the hips in the socket gently while the hips become more stable. In a little bit older age group, if it's detected later, sometimes the child has to undergo anesthesia, and the reduction of the hips is performed under anesthesia. Then the child is put in a body cast for a few weeks until the hip becomes stable. Now, really older children, the children that are walking, if it's detected at that age, then surgery is needed. But early treatment is really the key, and it's almost always successful. So these children can go on and live very normal lives and be productive and active in sports and so forth, but it needs to be detected early. As a parent, one thing you can do is to be sure that you don't swaddle your baby with the legs held tightly together. If you put the legs tightly together, it can aggravate the condition. Some pediatricians and others recommend using multiple diapers or little bolsters that hold the legs a little bit apart. And if you want to know more about hip dysplasia, Larry the Cable Guy has formed the Get Her Done Foundation, and he's helping promote awareness of hip dysplasia. And you can visit our website at hipdysplasia.org. Thanks a lot.